Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. Today we're going to have a discussion about two unique technologies. One is Coolsculpting, freezing the fat, and the other is Ultherapy. Both very popular technologies. They've been around for a while. I actually dabbled with these technologies for a while, so I have some understanding with them. And people ask me all the time. So I thought, why don't we have a podcast on these two technologies? So let's start with Coolsculpting or freezing the fat. Very, very popular. Celtique, it's a technology that was probably really realistically the first of its kind in which you actually had some non-surgical procedure that truly caused fat to go away. So what's the technology? It literally is freezing the fat. So what happens is it turns out that fat, unlike muscle, for example, or skin, is a really sensitive tissue. We call it stubborn fat, but actually it turns out that on a cellular level, it's very fragile. And so when you freeze the fat, actually freeze it, and then thaw it out, the fat, and not the muscle, not the skin, the cells apoptose, which is programmed cell death. They explode. They internally explode or implode, and then your body just absorbs them and you eliminate it. So pretty awesome. So what they realize is that by freezing using paddles or technology, certain areas, and then thawing it out and redoing this technique over again, that the area, that fat cells, a percentage of them will slowly just resolve and you'll lose the fat. Next question, does it work? The answer is yes, it does work. The question is how well, in whom, and what candidates. So the reason why you have such varying responses or people online, oh, Coolsculpting was amazing, it was the best thing I ever did. Oh, Coolsculpting was terrible, the guy was a charlatan, he took my money. It's because, like everything, it's about candidacy, right? If I, do laser eye surgery on somebody who's got almost perfect vision, they're going to say it was a waste of time. So you have to be the right candidate for the right procedure, and we'll get into candidacy. But does Coolsculpting work? I do believe that it does work. So who's a candidate, who's not a candidate? In order for Coolsculpting to work, it's a device, a machine. It's got paddles, and paddles are basically these two plates that freeze up. The plates freeze up, and the tissue needs to be in between these plates. So by definition, the area that is being frozen needs to be malleable so it can fit between these two plates. What areas are those? Your lower abdomen, you can squeeze it and pull it in. Your love handles, you can squeeze it and pull it in. Your arms, the arm fat behind your arm, you can pull it and squeeze it in. Your inner thighs, you can squeeze it and pull it in. There are areas, and the technology advanced, where they use the paddle, where it was only one size. In other words, you just put the cold pad on one side, but there's not a pad on the other. I honestly don't think it works as well as when the tissue is in between the two pads. What areas are those? Well, for example, the outer thigh. You can't really squeeze the outer thigh and pull it in. It's very tight. Or under the neck. And I have found that those areas don't work as well as the areas that you can grab, like the love handle or lower abdomen. So if you have good skin quality, again, notice this is similar to the liposuction podcast I gave. When you remove fat, I don't care if it's from weight loss, I don't care if it's from liposuction, I don't care if it's from Coolsculpting. You're asking the skin to snap back. And so if you have good skin and soft fat, you should see a good return during Coolsculpting. If you have not so good skin, thin, loose, not such good fat, maybe mostly skin and not that much fat, or very fibrous fat, then you won't see as much of a return. So candidacy is very, very important. Where is it done? It's done in the office. You come in. Now the technology has advanced. It used to take an hour per paddle. So imagine a paddle being the surface area of your hand. So it would take an hour to do one area the size of your hand. But now the technology has advanced to it's 30 minutes. You can even have multiple paddles put on to accelerate it. And so you come, you sit, you get on an iPad or your phone, and the device is moved around from area to area, freezing that section of fat and then thawed out, and you move on to the other area. It is mild to moderately uncomfortable for most people. There are the occasional people who just can't tolerate it. Recovery is relatively easy. You might feel some aching or some discomfort or some tingling, but by and large, most people kind of go back to their normal way of life. Probably go back to exercising that aggressively for a little while, but by and large, it's relatively well tolerated. So, what are the risks? The risks are pretty minor, I have to say. Like anything that removes fat, it has the risks of being asymmetric, or moved a little more here than there. It has the possibility of a little bit of loose skin, but way, way less than any liposuction. It has the ability to have some bruising or some numbness or nerve pain for a while. But all these things, in my opinion, are relatively minor. The most concerning risk, which is also minor but is major when it occurs, is something called PAH, paradoxical adipose hyperplasia, which is, ironically, the exact opposite thing happens than when you went in to get it done. Paradoxical, meaning the opposite, adipose, fat, hyperplasia gets thick. So you freeze an area, and instead of disappearing, these fat cells get irritated, and then they thicken. And naturally, that would be terrible. And the treatment for that is, of course, then you got to go and liposuction that area. Not ideal. But luckily, it is not super common, but it is definitely not unheard of. So in general, I think Coolsculpting is a reasonably good technology. It does work in most people. Like all things, you have to be a candidate. You cannot expect to go in and do Coolsculpting one session. Any area that you do, let's just say your love handles, each love handle you want to do at least 2 to 3 rounds separated by about 6 weeks. One round will not cut it. If you cannot afford it, don't bother doing at least 2 to 3 rounds. And while you don't get necessarily the same results as you would with liposuction, meaning you can expect maybe a 25% reduction, remember, you didn't have to go under the knife. There is no surgery. There is no surgical recovery. There are no surgical risks. So in some instances, busy people, people who are afraid of surgery, it's not a terrible option. And as a result, it is an alternative to fat removal when you're thinking of options. Okay, so I hope you understood Coolsculpting as a whole. We're going to take a quick break. When we come back, we'll dive into the world of Ultherapy, and we'll discuss pros and cons and what you need to know. Welcome back to the second half of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. So what are we talking about now? We're going to be talking about Ultherapy. What is Ultherapy? Ultherapy, as the name Ultha stands for, is ultrasound therapy, ultrasound using a device that uses ultrasound to do skin tightening. So the holy grail of all holy grails of non-surgical treatments is finding a device that tightens skin. If and when we find this device, I essentially could be out of business. Think about it. Upper eyelids, excess, tighten the skin. Neck and jawline, tighten the skin. Saggy breasts, tighten the skin. Excess skin on the belly, tighten the skin. Loose skin, inner thighs, tighten the skin. Arms, tighten the skin. So as you can see, if we had, which by the way, we do not, have a machine that tightens skin, it'd be game over. There'd be millions of such devices. So what the hell is Ultherapy? Well, Ultherapy is a little unique. It's a device that was designed to tighten the skin of the face and neck. Wait, I thought you just said there is no such device. Well, that's kind of true. Initially, the idea was you use the Ultherapy along the face and jaw. You send ultrasound energy aka heat, down into the muscle layers of your face. The heat then causes the skin, we call that the fascia, of your muscles to tighten, and indirectly, as the skin or the fascia of your muscle tightens, it pulls and tightens your facial structures. That's the idea behind Ultherapy. Now, I don't think that's actually what happens. And I think initially that's what they had thought and they had hoped, and they had some instances, like everything, certain candidates that had improvement, and the photos would show improvement, and they assumed it was due to tightening of the skin. In hindsight, I think when you look carefully, in my opinion, I don't know this to be fact, what you're essentially doing is, as you're sending the heat through the face, you're not really tightening the skin of the muscle, aka the fascia, but rather melting some of the fat that's located along the jaw, the cheeks, the jowl, and the neck. And when that fat goes away, your underlying structures show up more, and you look like you're a little bit more chiseled, skeletonized, or more anatomic. So the question is, does it matter how it's working if you're looking better? And the answer is yes. So that gets to me who's a candidate and who's not. The people that I think are good candidates for Ultherapy are individuals who are early, not quite ready for a facelift, don't have a tremendous amount of skin, but want to do something preemptively and proactively in order to kind of keep their face looking good. But they must have kind of fatty faces, because I think the benefit comes in people whose face is full, because I think there is inevitably some melting of the fat of the face. And in those people, I think it's a good alternative. In individuals who have either a lot of neck or jaw excess skin, in which case they absolutely need a face and neck lift, or have very thin faces, I don't recommend Ultherapy, because I think you get what some people had complained about, which is hollowing or skeletization of your facial features. And obviously that's not the objective. So, key is be the right candidate. What is the procedure? So the procedure is you come in, it is moderately uncomfortable. You need a little bit of pain meds, a little bit of numbing cream. It's similar to a laser skin hair removal or things like that. It is not a laser. It's ultrasound energy. It's not on the skin. It's deeper, but it has the same sort of rubber band snapping feeling. So we give you some pain medications, some numbing creams, and some muscle relaxants. And the procedure takes on average depending on what areas you do. So what areas can you do? You can do your forehead and brows. You can do your upper face. You can do your lower face. You can do your neck. Or you can do all those areas. And depending on what you do, it can take 30 minutes to an hour to an hour and a half. Once the procedure is done, the recovery is actually remarkably easy. There isn't a lot of residual pain. There isn't much redness. There really isn't much at all. And in that regard, I think the Ultherapy is pretty good. Unlike a laser, which again, this is not, you don't have all this skin slough and all these other things. You can kind of go back to your work and exercise pretty much the next day. When do you see the results? Usually it takes about 6 to 12 months. It's a gradual process. Unlike Coolsculpting or other things that you see results in a few months, this takes a long time. So if you're looking for an immediate result, do not get Ultherapy. It takes some time. So what are the risks associated with this procedure? To be honest with you, the main risk and the only risk is this idea of skeletonizing, meaning as a result of heating up the face, as a result of tightening the underlying structures, you melt some of the fat that in skinny-faced people is necessary to make you look youthful. Otherwise, I've really not heard of much else. If someone is using the technology correctly, there should be really limited issues. Yes, you can use it and do it over a nerve and get a little bit of facial paralysis. That's known to be temporary. You can get bruising, you can get pain, you can get neuralgias, all kinds of things like that. But when the device is used correctly, it's usually unlikely and rare. So, as always, what is the wrap-up? Ultherapy, I think the device is okay. I think it's used in the right person, you can get some benefit. You need to be kind of a full-faced, round-faced, younger individual. I think in those people, they'll see a benefit around 6 to 12 months later. If you're hollow-faced or have a lot of skin, you should either refrain or in those instances, consider a mini facelift or a full facelift as necessary. And that's it, guys. That wraps up another episode of Plastic Surgery Uncensored. I hope you've enjoyed going over these topics with me today. As always, if you have any questions, any concerns, send us DMs. And if you love the show, please share it with your friends and family. Download our episodes, subscribe, and follow us on our different platforms. Once again, this is your host, Dr. Roddy Raban. I look forward to seeing you guys next week.